Trichomonas vaginalis. What is Trichomonas vaginalis, also known as trichomoniasis? Trichomonas vaginalis is an aerobic flagellated protozoan parasite and the causative agent of sexually transmitted disease called trichomoniasis. It is the most common pathogenic protozoan that infects humans in industrialized countries. Distribution. Trichomoniasis is the most common sexually transmitted infection, STI, with an estimated annual incidence of 276.4 million cases globally, a protozoan that infects the urogenital tract. Habitat. Trichomonas vaginalis causes disease. It inhabits the vagina in women, the prostate and seminal vesicles in men, and the urethra in both sexes. Morphology. Trichomonas is around 10 micrometer in length and is normally pear-shaped. It has 4 flagella at its anterior end, distinguishing itself from closely related organisms that have difference of numbers of anterior flagella. At the base of these flagella are the parabasal bodies, kinsomes, accompanied by Golgi stacks. Life cycle of trichomoniasis. The trophozoites in the vagina and the prostatic secretions in the urine multiplies by longitudinal binary fission, and the trophozoite in the vagina or the urethral orifice is noted. So this stage where the trophozoite is present in the vagina or the urethral orifice is the infective stage of this disease, and during the process of the sexual intercourse, it passes from one person to the other person. So as we learn, the trophozoites are the infective stage as well as the diagnostic stage. The disease is transmitted by the sexual mode, and the trophozoites divide themselves by the longitudinal binary fission, which gives rise to the daughter trophozoites, present in the urogenital tract, which infect the other individuals. Pathogenesis and clinical features of Trichomonas vaginalis. Trichomonas vaginalis is a protozoan parasite responsible for trichomoniasis, a sexual transmitted infection. Its pathogenesis involves the parasites attaching to and invading the vaginal epithelium, causing inflammation and damage. Clinical features typically include vaginal discharge, often frothy in malodorous, vulvar itching, dysuria, and dysphoria. However, many individuals infected with Trichomonas vaginalis are asymptomatic. Testing and treatment are crucial, as untreated infections can lead to complications and increased risk of transmitting the infections. Immunity. Trichomonas vaginalis, a sexually transmitted parasite, does not confer immunity upon infection. This means that someone who has had the infection before can get it again if exposed to the parasite. Diagnosis. Trichomonas vaginalis is typically diagnosed through a combination of physical examination, microscopic examination of vaginal discharge, and laboratory tests such as nucleic acid amplification tests or antigen detection tests. These tests can detect the presence of the parasites, DNA, or antigens in vaginal fluid samples. Treatment. Trichomoniasis is usually treated quickly and easily with antibiotics. Most prescribed antibiotic called metronidazole, which is very effective if taken correctly. It usually have to take twice a day for 5 to 7 days. Prevention and control. Practice safe sex. Consistently using condoms during sexual intercourse can reduce the risk of transmission.